All right. Well, hello. Good evening, everyone. Welcome to another edition of the Beauty in Us Radio, right here on Awesome God Radio. I'm your host, Nelson E. Brown, and I want to thank you all again for tuning in to another show and another broadcast. I'm very excited about what I have to share this evening. I have another special guest this evening, Maryland State Delegate Jocelyn Pena Melnick, and she's going to be speaking to us about health inequities, health health disparities, and all of the work that she has done and that she continues to do under the Health and Government Operations Committee in the Maryland General Assembly and the House of Delegates. Now, I wanted to have a conversation today about what health-related disparities are and what it looks like to really fight for our rights. And by our rights, I'm speaking about rights that pertain to our reproductive rights, our reproductive health, the rights that pertain to our behavioral health, rights that pertain to access to Medicaid, public health, and what that means. I also wanted to discuss health occupations and a wide variety of things. I had a chance to really take a look at some of Delegate Jocelyn Pena Melnick's highlights of this past legislative session in the Maryland General Assembly, and she's been able to accomplish a lot. And again, she serves as a member of that body under the Health and Government Operations Committee, and she's had a chance to really not only represent her constituents within her district in PG County and a couple of other surrounding counties, but also she's had a chance to really dig deep and really focus on a lot of the health-related disparities that persist that exist between a lot of the marginalized communities that she represents. Now, again, we want to think about this from a broad standpoint because, again, Delegate Melnick, she represents District 21, Anne Arundel, and Prince George's County. She is also an attorney, and she has done a lot of great work on this committee, and I wanted to talk about that with her. So she'll be appearing on the show in about 15 to 20 minutes. But in the meantime, I want to speak a little bit about what it means to really, what does it really look like to be aware of what the social dimensions of health are. So I was going to say, you all know that I had an internship a while ago with the MedStar House Call program with MedStar Health, and one of my assignments was to put together a presentation about the social dimensions of health. And the reason why I was assigned this assignment is because in order to really figure out what the health-related disparities are, we have to recognize the social dimensions of health once we really see them, once we feel them, and once we really take note of everything. So when we talk about the social dimensions of health, those are some key points, key notes, some key things to look for when we think about whether or not we live in a healthy environment, whether or not we live healthy lives, whether or not we have access to the resources we need to be healthy and to be happy. So I was given the task to create a presentation about the social dimensions of health because, again, in the healthcare industry, there are marginalized communities that are affected by the social dimensions of health primarily and the lack thereof. So when we talk about the social dimensions of health, we have to recognize the difference between health equity, health disparities, and health inequities. A lot of people don't really understand the difference between those three things. So I want to explain that with you guys so that you can have a better understanding of what we'll be discussing this evening with Delegate Melnick. So health equity, when we talk about health equity and when we speak about the healthcare industry in general, we have to think about the fact that health equity is all about how you attain the highest level of health for everyone, which is all people. And health equity is only achieved when every person has the opportunity to attain his or her full health potential. And no one is disadvantaged from achieving this potential because of social positions or other socially determined circumstances. So again, health equity is all about making sure that everyone is healthy and happy, regardless of their socioeconomic status, regardless of whatever circumstance they might be in, regardless of how much money they make or where they live, or how they live or whatnot, what color their skin they are, which gender they identify with. All of those factors are thrown out the window when we talk about health equity. Now, health equity is probably a term that you will hear about this evening and throughout your lives when you speak to people who work in the healthcare industry. So, a lot of healthcare professionals think about health equity, health inequities, and health disparities, but we have to really learn how to distinguish between all three of them because people think that they're used interchangeably and they're not. They all have different meanings. So, again, health equity is about us attaining the highest level of health for everyone, for all people, regardless of their socioeconomic status or whatever circumstance they live in, regardless of, how much money they make or how little they make. So that's health equity. When we think about health disparities, we have to think about the differences in health status between people that are related to the social factors or the demographic factors. And again, like I described before, race, gender, age, income, geographic region. These are examples of factors that people use when they look for health disparities. So when we talk about health disparities, and again, we have to think about the health status of the people that we live around. We have to think about our community. We have to think about whether or not our community has access to the resources that we need. So those resources could consist of healthy stores to shop. Those resources again, and this is not just about us. This is also about the school setting. This is also about whether or not we have thriving businesses. This is also about whether or not the minorities within a community have access to a primary care physician, whether or not people have health insurance or medical insurance to cover their bills. So these are some of the things that we'll be talking about this evening, and these are some of the things that we can think about when we think about health status and the differences between people who identify with these marginalized groups that have these disparities. Again, race, gender, age, income, geographic region, those are some factors that people use to distinguish between the health status amongst the social groups that are there, that are out there. And health inequities, which is the last one of the three, is the differences in any health outcomes by race or other social constructs, which is a term that is used in sociology. As you guys know, I have a sociology degree from UMBC, and I have an associate's degree in CCBC. So I took a lot of sociology classes. And again, social constructs have a lot to do with gender identity and expression, class, immigration status, sexual orientation, incarceration history, and whatnot. All of these factors, all of these social constructs represent the differences between the health outcomes. And again, we think about the social inequities, and we also think about the structural inequities when we think about health inequities. So again, I'm a sociology graduate, so I have a sociology degree. So these are some of the terms that I'm going to be using this evening when I speak to Delegate Melnick, because again, people don't understand the difference between health inequities, health equities, and health disparities. But I'm trying to explain it as clear and as concrete as possible. So when we think about the social dimensions of health, we can also think about whether or not there's economic stability within a community. That has a lot to do with a person's finances, how they spend their money, how they make money, how much money they have. That can have something to do with their health. A person's finances and their health, there's a link there. So there's a link between a person's finances and their health, how they spend their money, how they make their money, how much they have, how little they have. These are some factors to consider when we talk about the social dimensions of health. And again, someone's access to healthcare and the quality care in the medical industry are some of the healthcare related challenges that some people face. Education, again, the connection between a person's access to quality education and their health is another factor. Again, when we think about the field of gerontology, which is the field that I worked in as an intern, we think about how diverse and inclusive the aging community is on a local level, and throughout the state, and even on a national level. And when we think about our neighborhoods, we can think about the fact that people, whether or not they have affordable housing, stable housing, as well as the environment, all of this plays a role in a person's health. So these are examples of what to look for when we talk about the social dimensions of health within a community, not just locally, but also globally. So all of these are examples, but there are some other examples. So some include crime and violence, accessible and healthy foods, higher education, early childhood education, secondary education, employment, housing stability, access to reliable and affordable transportation, health literacy, access to primary health care, and access to health care coverage. So these are some of the other examples that we can look for when we talk about the social dimensions of health, and this will help us determine whether or not a person's healthy or whether or not a community is living in a healthy environment with healthy outcomes, and whether or not the disparities are there or the inequities are there. So when we think about healthcare access and affordability, we have to think about the fact that 1 in 10 people in the United States don't have health insurance, and that people without insurance are less likely to have a primary care provider, and they may not be able to afford the healthcare services and medications that they need. So some of the strategies to increase insurance coverage rates are critical for making sure that more people get important healthcare services like preventative care and treatment for chronic illnesses. This is a lot of stuff that I learned about not only in school, but in my internships with the House Call program, and even with the Maryland Department of the Environment. And even when constituents contacted Senator Ben Cardin's office, I had a chance to really learn about the agencies and the constituents' issues and concerns in terms of them trying to attain affordable insurance to cover their needs and their families' needs. So these are some of the things to also think about. And at other times, um, interventions are often used to increase access to healthcare professionals and improve communication in person and remotely. Because again, everybody is not able to go to the doctor for a checkup. So sometimes people don't get recommended healthcare services like cancer screenings because they don't have a primary care provider. And sometimes they live too far away from their healthcare providers who may offer them. So again, transportation, as I stated before, can be an issue. But when we talk about, again, the field of gerontology, we think about our seniors and the chronic illnesses that they suffer from. But we can also think about the fact that the United States population of adults ages 65 and over is projected to double between 2005 and 2030. So again, 2005, of course, is it's long gone, but we're definitely headed to 2030. And this escalates the demand for medical care, increasing the national healthcare burden. Those over age 80 are the most likely to be frail with multiple functional impairments and chronic conditions, according to sources and what they say. And this population segment accounts for the highest healthcare consumption. So chronic care for elders requires ongoing low-intensity support. Much of it is not strictly medical, which is in stark contrast to acute care that's delivered in the U.S. hospital system. So again, we have to remember our seniors. So when we speak about gerontology, we think about our seniors. And when we think about healthcare access and affordability, we have to think about the people who may not be able to afford it, the people who may not have access to reliable sources of transportation, and strategies to increase insurance coverage rates. So again, these are all components of the social dimensions of health. Again, the economic stability, how much money people have and don't have. We have to think about the neighborhoods where they live. We have to think about our schools. We have to think about hospitals. We have to think about all of these things when we think about social dimensions of health, the disparities, the health inequities, and the health equities within a certain village or within a certain community. So again, this is all prevalent to what we will be discussing this evening with Delegate Melnick. But I want you guys to just take some time to really think about what the health-related disparities are within your community. If you could really look around and really think about what the problems are within your community and why people are living unhealthy lives. I'm not just talking about people who make reckless decisions like smoke or drink or party or whatever. I'm talking about people who are very impoverished. I'm speaking about people who identify with the low income neighborhoods that we often hear about, read about. I'm often thinking about the people who may not have access to, again, a lot of the things that other people can't afford. So what is the barrier that's keeping the haves and have-nots from having the things that the people who have? So these are some of the things that I want to think about. So without further ado, as we make this transition, I want to introduce you all to Maryland State Delegate Jocelyn Kenya Melnick. She is she's a member of the Health and Government Operations Committee under the Maryland General Assembly's House of Delegates. She's agreed to speak with me about her role on the committee and also about this entire conversation. So, Delegate Melnick, I want to thank you again for agreeing to take some time out of your schedule to appear on my broadcast to speak about this very important subject. So, I spent the last 15 minutes speaking about the social dimensions of health. So, the social dimensions of health, I learned about that when I was in school, when I was studying for my sociology degree at UMBC. I studied it at CCBC for my associate's degree, and I had three internships before my current role that really placed an emphasis on the social dimensions of health. So with everything that you've been able to accomplish, because I read the highlights that you sent. With everything that you've been able to accomplish, well, first off, could you tell us a little bit about yourself and what led you to being part of the body in the General Assembly, and what led you to your work on the Health and Government Operations Committee? Because you've been able to cover a wide variety of issues in the healthcare sector. But could you tell us a little bit about what led you there?
Well, thank you so much first for having me. I really appreciate your work and the consideration. It's an honor and privilege to be here. I actually was born in Dominican Republic. I came to this country when I was 8 years old with my mother, who was a single mother of two girls, my sister and I. My sister and I are what you call Irish twins. We're 11 months apart. So for about 25 days in June, we share the same age. So my mom had her hands full with two young ladies, close to 7 and 8 years old. And when we arrived to New York City from Dominican Republic, where there are a lot of Dominicans, we didn't have a place to live because my father and my mom had separated and he came first. And when we arrived, we didn't have a place to stay. We stayed with my father's brother for a little while. And then we ended up having to stay with one of my mom's friends in an apartment. She allowed us to stay in one of her bedrooms. So we early on, I learned the struggles of poverty, of not being able to make it, and seeing my mom not knowing the language, right? Not being able to speak a word, trying to find work, trying to learn English, being on social services. I often will go with her to the office, and then with the, few words I knew in English, she would actually, ask me to help others that were waiting and translate for them. And they were mostly women of color, Black and brown women. I mean, I am a Black Latina, right? This color doesn't come from being at the beach. We had slavery in the islands. So, we faced a lot of hurdles, a lot of obstacles in New York City. From that young, I decided 8 years old, I did not want to go through that in my life. And I wanted to get an education. So I ended up going to college, the first in my family. My sister had a baby when she was very young, 16. And I knew I didn't want that. I saw my mom get off social services and find work, but we still had help, right? We got food stamps and Medicaid, and that's how we were able to have a little access to care, right? Not a lot, but some. And then I went to college. I became educated. I also went on to law school, first in my family to do both, something that I don't take for granted. And I have been able to help my sister who finished her degree, actually, like in the last 7 years, three of her four kids graduated college. I have three kids. My kids, my son graduated last year. Our daughters are twins, and they graduated this past year. So it's about having options in life, having the flexibility when you have an education. It is the greatest equalizer. It truly is. And I have had an interest my whole life in civil service and speaking up for our Black and Brown communities and our communities that are often in the shadow, not seen, invisible. So when I finished law school, I became a public defender. Then I was a prosecutor. I also did work representing children that were in the neglect system. They were abused physically, emotionally, sexually. And after staying home for a while with my kids, I decided to get involved in the community and volunteer at the local level. And I ran for the city council and then ran for the state. So my background is it's a story of many people in our community, right? The Black and Brown people, their struggle, the story of many immigrants as well. So I know very well what those social determinants of health, how they affect us, right? Because it's the way we live, often in very crowded places. We learned that from COVID. It is the lack of education, the lack of transportation, lack of money, living in a place where, the environment affects you as well, right? Often Black and Brown people during COVID were the ones working with the public in hotels, the restaurant industry, right? They were not able to stay home like you and I on Zoom and do all our meetings. So I have lived that experience, right? So when I legislate, I speak from experience and I bring that to the table.
Yes, absolutely. Thank you for sharing that. And you definitely come from humble beginnings. That's what I gathered from everything that you said. So you definitely come from humble beginnings, and you're able to identify with a lot of the marginalized communities you represent, and a lot of them because you since you're a minority, you're a woman of color. You come from humble beginnings. You know what it's like to actually struggle, and you've been able to prove that you can grow beyond that circumstance, and that you can give back. You can use that experience to give back and to make a difference, which is definitely fantastic. And again, I read your bio, and you've done some amazing work throughout the years, while you were in college, and even being a part of the body that you're a part of. And even in your bio, I read that you are an active member in the Maryland Legislative Latino Caucus, the Legislative Black Caucus of Maryland, and other appointments. So what does it look like to go back to your neighborhood, the neighborhoods that you represent, and really, even once the session's over, what does it look like when you're not in session? What do the neighborhoods look like? What does your district look like? Because I know that you represent District 21, which is composed of Anne Arundel and Prince George's County. So what do
Right.
those what does that, because I'm not familiar with both of those counties. So I personally would like to know what do your constituents look like in terms of what kind of communities do you represent? Because each community has different needs. Each community has different resources, or may need resources more than others. So what do those communities look like?
Yeah, and I represent District 21, as you said, which is two counties, Prince George's and Anne Arundel. They're very different counties, right? Prince George's is majority Black and Brown. Anne Arundel is majority white. We have people that are very poor, people that are, middle class, people that are, upper middle class. Not a lot, but we have them. It is a working community, that people that are working hard to put food on their table, right? That worry about their kids' school. They worry about having access to care, being able to see a doctor. Those are the people that I represent. Those are the struggles of the people that I represent, that I fight for everyone every single day. The district, some of the cities in my district are College Park, which is the University of Maryland is in College Park, right? So they're my constituents. You have the Beltsville Research Center, right? in my district, but then you have Beltsville that is not incorporated. You also have Calverton. You have the city of Laurel, except South Laurel. So I have the city of Laurel and West Laurel. And then Anne Arundel County, all the way to Odenton, right? And Crafton. So they're very different communities, but the needs are the same. People care about the same things. They want to make a living. They want to provide for their family. They want to have health insurance, right? They want to have opportunities. They want an education. They want to live in a place that has clean air and water as well. So it's, although they're different, they want the same things, their quality of life, right? Which is so important. So I fight hard for them, for all of them, because they want the same thing. Some have more needs than others, and we try to be fair and equitable, with an equity lens, always legislate with an equity lens. And that's important. That's important and a very important part of the process, the legislative process.
Yes, absolutely. And again, I like the fact that you do represent um, uh, two very diverse counties because a lot of people, again, they look at the needs for one county and they try to compare them for the others. And oftentimes people neglect the most vulnerable populations because of the work that's required in order to make sure that those constituents have what they need. It's easier to pay attention to things that are going well, for a certain group of people. It's easier to devote time and attention and to invest money into communities that are well off. But really requires much more work to really dig deep and figure out what the needs are for the low income communities and the people who do need more. And again, like you said, the social dimensions of health help us determine who needs what in each community. And again, this is not just about whether or not they have access to health care coverage or whether or not they have access to insurance. This is also about whether or not the schools provide education that's affordable to a lot of all of the children, whether they're a part of the Black and Brown community or not. This is also about um, communities having access to stores that sell healthy foods so people can go and buy groceries instead of just going to a dollar store or a liquor store to just get snacks or to just get alcohol or whatever. This is also about, excuse me, this is also about, again, providing transportation to the people who may not be able to attend their appointments. And I'm talking
Right.
mainly about our elders, our senior citizens who may be, home and who may suffer from a lot of underlying conditions, who may suffer from chronic illnesses. So this is about all of that.
That's
We,
right.
we often think about the social dimensions of health as as one aspect of it, but this covers everything. So I like the fact that you do represent very diverse counties, but again, everybody wants to live a healthy life. That's what everybody has in common. So my next question is, I know that you talked a little bit about your roles on the Health and Government Operations Committee. So why do you think it's important for constituents to really educate themselves about the healthcare industry? Because a lot of people don't really know what's available to them. A lot of people aren't provided with the necessary resources or education to really make wise decisions for themselves and for their families. A lot of people don't know, who to turn to or who to ask for these resources if they don't have the means in order to acquire what they want. So, why do you think it's important for people to understand the ins and outs of the healthcare industry, and why do you think it's important for people to just educate themselves about what it means to really identify the social dimensions of health that we talked about?
It's important because you have to be your own advocate, whether it's for yourself or a loved one. So you have to first, if you're not able to afford health insurance, if you don't have a job, and you're here, your legal status, and you're here legally, you can apply for Medicaid, which is the health insurance that the state of Maryland offers, right? Public health insurance. And you're able to go to the doctor and have access, whether you're a child or you're an adult. So we have a little over 6 million people in Maryland, And we have about 1.8 million people on Medicaid, which is the health insurance that the state of Maryland provide for people that are poor. And then you have the private insurance market, right? You have one of the biggest carriers in Maryland is Care First Blue Cross Blue Shield, right? So Care First Blue Cross Blue Shield. And then you also have Aetna, you have actually Cigna, you have Kaiser Permanente, right? You have all these other insurance companies that people can buy insurance from the Maryland Health Benefit Exchange. They can buy private insurance, and they can also get screened for Medicaid as well through the Maryland Health Benefit Exchange. And it's based on your income. And for some of those private insurance policies, there are subsidies that are offered in Maryland if you make a certain amount, right? So it's based on your income. There's also subsidies for young adults that we passed a bill to create subsidies for young people. There are policies that can cost you $50 a month for a young person, right? Because you're healthy, and that helps. The healthier we have people that we get into the market, it helps everyone else, right? The very sick and the old, to spread the cost when you pay your premiums. So in Maryland, either if you're very poor, you can apply for Medicaid. If you are able to pay, you can purchase insurance in the private market or through the Maryland Health Benefit Exchange, and we have subsidies to help pay for those. So we have a lot of programs. When you do your taxes, there's a little box, and I actually, was worked on that bill. Was one of the sponsors that basically says, do you have insurance? And if you don't have insurance, may we connect you to the Maryland Health Benefit Exchange so they can help you find an affordable policy. So the role of my committee has been making sure that we have access to care in the state of Maryland. So our committee was the one that helped create the Health Benefit Exchange, right? When Obamacare passed, the Maryland Health Benefit Exchange. Then we went on to stabilize the individual insurance market, people that were not able to buy insurance from their employer. And then we created a reinsurance program to help people have their premiums be very affordable as well. So we have done a lot to reduce that number, but we still have about 350,000 people in Maryland that are uninsured. 275,000 of them are undocumented individuals. The other left 100 and something thousand are people that probably have not applied for Medicaid, right? Or they have not bought insurance and can get some kind of subsidies. So our goal in our committee is to reduce that number. And we have been able to do that through all these bills that I discussed. And many of them I actually introduced those bills as well. And our committee is also responsible for, to help when it comes to the insurance in Maryland, right? Healthcare insurance. Also, we pass all the bills that deal with occupational licenses for the doctors, for the nurses, right? As well. We also do government operations, which is procurement and MBE, to make sure that we have laws that protect, especially people of color, when they are bidding for these contracts at the state level as well. So we have a committee on my committee, a subcommittee on public health, to make sure that we invest in the public health system. One thing that we learned from COVID is that our public health system was broken and that we had not invested in it for decades. So we passed a bill this session that creates a public health commission. And we also passed a bill that creates a commission on behavioral health as well. So behavioral health is very important, especially when it comes to communities of color, right? Where it's taboo to even talk about it. So our committee has been focused on reducing the number of uninsured, making sure that people have insurance, making sure that, people have their licenses and that the standard of care is excellent, making sure that we have, procurement laws and that we address people's mental health and behavioral health. It's really a lot of work, but it's exciting. And you can see my passion. I love it. I love doing it.
Absolutely, and I do too, because like I said, I had internships while I was in college, in the healthcare industry, and I work in the healthcare industry now. And all of the stuff that you just laid out on the table, I've been able to really see that firsthand because of my not only my knowledge in the classroom and with my degrees, but also in with the certificate that I hold in the social dimensions of health and the experience I was able to gather by working, for MedStar Health's house call program and working in the field of gerontology and even helping constituents out at the federal level in Senator Cardin's office with many of the issues that pertained to them seeking assistance from whichever federal agency that they were not getting a turnaround time from. I was able to really examine all of their needs. A lot of the low income communities under the house call program that I had a chance to really work with, a lot of them didn't know which routes to take in order to acquire what they needed. A lot of people who do live in these low income communities and who do have caregivers, a lot of them are very stretched are stretched very thin with their resources
That's right.
because they don't have access to what they need access to. Oftentimes they pay out of pocket for a lot of their expenses when they don't have affordable insurance or when they don't have access to quality care. And I think that that's something that I'm glad that your committee has been able to address, not just at a local level, but throughout the state of Maryland. You guys have been able to really look at that, look at everybody's needs who do identify with those groups of people, and you've been able to address all of those needs because people want the resources and people want the affordable care, but they just don't know which route to take in order to go about that oftentimes. So I'm
Right.
glad that you guys have been able to provide all of these bills. You've been able to bring this to the forefront. You've been able to really listen to all of the constituents who contact your office and who really um, express their needs and voice their concerns about them or their loved ones and their families. Because, like you said, we all just want to live healthy lives, whether you are insured through the government or whether you're insured through the private
That's correct.
companies. Everybody wants to live healthy and happy lives. Oftentimes people um, try to compare differences and people try to place one against the other, but in all actuality, everybody wants affordable coverage.
Same thing.
Everybody wants to be healthy, because you don't know what people's financial circumstances are. So something that may work for you may not work for someone else.
Correct.
So it's better to be flexible and just to be open as possible to the people who may not make as much money as you make or may not have the same resources that you have. So that's I'm glad that you were able to really make note of that. So my next question is, what who has mentored you throughout the course of your time as a legislator? What do you enjoy most about it, and what is the most difficult? Because I know that this work is challenging, but it's very, very, you can definitely make a difference and you can definitely make a positive impact. But I know that this work is challenging, and I know that one person does not have all the answers to everything. So who has mentored you throughout the course of your time as a legislator, and what has made this role and this position of influence difficult or easy? So could you tell us a little bit about that?
Well, I think I've been very blessed to have really, God has placed in my path just some amazing women. Senator Shirley Nathan Pulliam, who is the queen of health disparities, right? Um, um, in Maryland, she was a former nurse for more than 40 years, born in Jamaica, came here, was in the House of Delegates, then in the Senate and retired. And she really was instrumental in making sure that I understood those social determinants of health, to make sure that I understood those health disparities, and that I was very supportive of those bills and how the data is so important. She always mentioned the data, being able to collect the data, because the data speaks for itself, right? If you don't want to fund something, how can you not fund it when the data shows that, especially during COVID, we have 23 counties in Baltimore City, 24 jurisdictions, and the county with the highest number of COVID-19 cases at one point, at the height of COVID was Prince George's County, which is the county of color, right? And why is that? Because when you peel that onion, you see the poverty, right? How we live in poverty. And then the CIPCO in the entire state of Maryland at the height of COVID, with the highest number at one time was 20783, which is where the immigrant community lives, right? So why is that again? They lack transportation. They couldn't go where the test sites, the first test site was actually open, right? In all the way 214 Six Flag, right? They don't have access to a car. They can't stay home. They have to be out there working with the public. So we learned a lot when we started collecting that data. She was instrumental in helping me. I introduced a bill that it's the Shirley Nathan Pulliam equity commission, health equity commission, and it's a commission permanent in government. It does not sunset. That basically requires that all 25 secretaries in the state of Maryland, right? Secretary of Health, Education, Transportation, you name it, Commerce, that they all must come together at least 4 times a year, work with CRISP, who's our state health information exchange, look at the data, and they must come up with an equity framework for each of their departments to address, the health disparities in Maryland. And that came from, she inspired me to do that work. Another great woman is a Speaker of the House, who's the first Black woman to be a speaker. And she's really has a lot of class, and it's just inspiring. And the other woman that I love very much is former Senator Kelly. She is amazing, and she retired. Dolores Kelly, and she was the former chairman of the finance committee, and she was amazing to work with. Easygoing, gave you respect, was a mentor. Never talked down to you, encouraged you, helped you out, was courageous. Was not afraid to take on something new and fight for it when it was right. So I've been blessed to work with these amazing women that have really inspired me to be better, right? As an immigrant, to come here from nothing. Like I remember before I came here, we lived with my grandparents, and at one time there were 17 of us living in a 3 little bedroom house in the Dominican Republic with an outhouse. Okay. It's and at times, sometimes at noon, we didn't have food. There was no food, and the houses were so close to each other that at noon in the islands, if you go to someone's home, people eat, right? They have their breakfast, they have their lunch and their dinner, and you can hear the plates next door. And we would take an empty plate and a fork, and we would hit it because we didn't have any food, so that our neighbors would think that we were eating. I remember walking to school with the sun when it was so hot, like around 12:30, 1 o'clock, for more than an hour to get to my home, and then come home and not find any food. Like when you live that, right? When you have lived through poverty, when you know what it's like not to have anything, you bring that lived experience to want to try to do better. There's no one at all that that I do not serve. Everyone, no matter your color, your background, you call my office, I reply. I go to your home, I go to a hospital, I go to a nursing home. I mean, I do this 7 days a week, and it's supposed to be part-time work from my heart. And so that's my staff. Like we help people find a primary doctor. We help people, we save people's home from foreclosure by helping them navigate the system and making the connections. We help people find shelter they do not have at home as well. I mean, we get all kinds of calls in my office. And when we're not in session is January to April until, December, and even January until April, we are in the community. Edith Perry, my legislative, she's actually my chief of staff and does a lot of the constituent work. We go the extra mile. We get all kinds of calls. and I have lived it. I've been there. So how can I not be responsive?
Yes, absolutely. I mean, like you said, this is a lived experience. You lived this experience. So, like you said, when you live the experience, you can definitely put yourself in the other person's shoes or the family's shoes. You can definitely identify with a lot of the communities that are considered to be low income and who are asking for help. And you want to be in the position where you can give back. That's what this is about.
That's right.
Because you're showing everybody, with your influence and with your leadership, that you can give back, you can make a positive impact, you can make a difference, and you don't have to be a victim of that circumstance, and that you can rise above that and again make a change. Oftentimes people think that just because they grew up in that circumstance, or they may be a victim of that circumstance, that that's just the way things are supposed to be, from that moment on. And a lot of people don't realize that you can definitely reach your potential. You can definitely work hard to come out of that and to rise above that. And I think that because of your influence and because of the work that you do, you're giving people that hope and that inspiration, and that guidance as they build a path to a better life and a better future. Because again, this is public service. This is all about doing the work for the people that you serve. This is about the constituents'
Yeah.
needs.
Yeah.
This is about the heart. It's about the attitude of your heart. This is
That's
not
right.
about anything else. So
That's
I'm
right.
glad that you've been able to do so much. You've been able to accomplish a lot throughout the course of your time as a legislator. And my next question is, what advice would you give to young people who want to make a difference in this line of work, if they're interested in becoming a public servant, a legislator, or if they're interested in just giving back? Because I know people who are community organizers and who are activists. They may not be in a position of influence in the political realm, but they do serve their community. They do have positions of influence locally. So I do know a lot of community organizers and activists who are in the community every day. What does it take in order to do this work? In order to really make a difference, in your role, in your current role, what advice would you give to a lot of young people who may want to do this in the future, or who may not be sure? How would you respond to that?
I would say, you must try it, right? And it doesn't require a lot except just the energy and the passion and commitment to want to make a difference. In my office during session, I had six interns and fellows, and they came from all walks of life. It was the United Nations. I try to be very intentional with an equity lens to make sure that my office is well represented, right? And that people have opportunities, because a lot of our, especially Black and Brown students, are not able to volunteer, right? They can't afford it. So it's to be able to have an environment where they can get a small stipend, and can come and help, makes a difference. And when you're in my office, I allow you to do everything that I do. So some of my fellows have given testimony for bills that I'm not able to give the testimony, to write the testimony, to meet with the witnesses, to meet with the advocates. I think that there are a lot of opportunities in our delegates and senators' offices, for you to come and volunteer and not just pick up the phone, answer the phone. I mean, we have receptionists for that, and you could do a little bit of that, but not that. To do the research, the writing, the presentation, to attend hearings, to sit with lobbyists, to sit with community members, and to sort of expand your world, right? And to see things not in a narrow way, but with a wider lens, to open your mind. I mean, I didn't have a role model growing up, so it was tough for me applying for college and doing all of that, but to be able to find someone in a very humble way like myself that would take the time, to make sure that you love the experience, that you have opportunities like myself. There are many other people, in the General Assembly that have the same passion and energy, and are willing to help and make sure that the young, are exposed and have the experience of working in government, to see how your government works, how the laws become laws, right? What does it take, like the sausage, to make that sausage? What are those ingredients? and to be able to expose you and have connections. Life, it's about connections as well, right? They can open doors for you. Not everything is money in life, the experiences are priceless, priceless. And it's an experience working in the General Assembly that is priceless, and it's inspiring. And you learn so much about so many topics.
Yes, absolutely. And I can attest to that because my last internship before I graduated from college at UMBC and after I graduated from CCBC was with Senator Cardin's Baltimore office. So I can definitely attest to that, that experience,
Yeah,
looking at legislation at the federal level and even working with some state representatives and local representatives. And even just like you said, like with the writing, the correspondence, speaking to the constituents, speaking to the staff members, and again, building coalitions and forming those partnerships with your colleagues. That's something that everybody should cherish. Every young person in college, every young person who wants to be in the field of public service, any young person who wants to make a difference in their community, that's an experience that I can attest to. I can say that it was definitely worth my time and efforts and everything. It was probably, out of all of the opportunities that I've had, probably one of the best because people don't really know what goes on behind the
that's
scenes
right.
when people are trying to figure out how to um, about how bring legislation to the floor and how to really again make sure that they are um, making sure that everybody's represented and that everybody's accounted for and that the legislation that they bring to the floor is accommodating everybody's needs, as many people's needs as possible, making sure that again everybody can have a roof over their head and food on the table for their
That's
families.
right.
Just
That's right.
this work behind the scenes. I've been behind the scenes, so I know what it takes. A lot of people, they have opinions about what lawmakers do and what they don't do, but they don't know what happens until they actually go behind the scenes and really see it for themselves. Because people think that a legislator can just wave a magic wand and just make things happen, just because they call their office and they want it. It's not that. It's not how it works.
That's right.
Yes, it
That's
requires
right.
everybody. It requires everybody to be on
That's right.
board. It's an all hands on deck approach when it comes to passing bills, bringing legislation to the floor, building partnerships, building coalitions. All of
That's
that
right.
matters, and it can't happen if everybody is being divisive. It,
That's
it
right.
only it only happens when people come together and bring their
That's right.
ideas to the floor
That's right.
and really figure out how to make it happen. Because it can happen, but it just requires everyone working together.
That's right.
Oftentimes, people try to they try to perpetuate a lot of divisiveness and they expect things to be done because you can't come together and then have divisiveness on the floor when you're trying to get things done and when you're trying to really examine the issues. People again, they create division, but they create division, but they want success. And you can't build coalitions and you can't build partnerships if if you're divided. It only happens when you work together. So, like
Yeah,
you said, that experience matters. So I encourage everyone to find out who your legislators are, and find out what kind of opportunities you can have to work with them and have internships and so forth, because it matters. It's a worthwhile experience.
it is
So
important. It's very
yeah,
important. And I tell you, as a legislator, it's we must we are fair, right? Open-minded. We all come with experiences, but we must not allow our personal experiences to dictate the outcome without having allow a bill to go through the process, right? Without giving everything its due respect, and consideration, right? And listening to everyone. And and people may not like when the advocates come, but there everyone has a role. Everyone has a role, right? Like your five fingers are so different, but you need all of them for your hand to function. We need the advocates, right? The lobbyists, the teachers, the doctors, the nonprofits. I mean, you need everyone to come and to us and talk to us about why a certain policy is important. But you cannot. You have to try to have an open heart and try to make the best decision, and that's what we all try to do. I really believe in that, and to be part of that as a young person, to be part of that process making right? It will help shape you into a person that is hopefully considerate and open-minded, to look at all the issues that affect everyone, right? Every issue we legislate affects whether you're young, old, poor, rich, right? So when we legislate in a way that is fair and equitable for everyone.
Yes, absolutely. So my last question, before we wrap this up, is how can people reach you if they have any questions or concerns? How can the listeners get in touch with you if they have a concern or if they have a question about anything that we discussed, or if they are interested in having the opportunity to work with you or your staff?
They can actually, my office, the number is 301-858-3502, 301-858-3502. They can reach and call my office. They can also call me on my cell phone number, 301-213-3604, 301-213-3604. We're there for the people, for everyone. And it's really, look, it's an honor to serve. Like, I am so blessed to be where I am and to have the opportunities I have had and experienced, especially someone from my background, right? Like, I am very, very blessed, and I praise and thank God every day for every experience. So it's, and for the people in my district that allow me to serve, which is why I don't take it for granted. I want to make a difference. I really do.
Yes, absolutely. Well, thanks again, Delegate Melnick, for agreeing to appear on my show. I'm very fascinated by all of the work that you do. I'm looking forward to what's on the table for the next legislative session. I know that you still have a lot of work to do. I know that you've accomplished a lot, but there's still more work to do. So I'm looking forward to what your committee does for the next legislative session. But between now and then, I know that you're going to definitely stay busy with your constituents in your district and all of their needs. So I'm looking forward to hearing more about what you guys are doing in your district and on the committee within that body. So I'm going to let you go, but I just wanted to thank you for taking your time out this evening to speak about this important conversation. The listeners needed to hear this. They needed to educate themselves about this, so I appreciate it.
Well, thank you for the time you have spent with me. Thank you for talking about these issues and for making a difference in your community. I appreciate you and your listeners.
Yes, thanks again, and I will
Thank
definitely
you.
keep you posted.
Thanks. Take care. Bye bye. Have a blessed evening.
You too.
Bye bye.
Okay, so that wraps up another edition of the Beauty in Us Radio right here on Awesome Guide Radio. I hope you guys really enjoyed the show this evening. I hope you guys really had a chance to learn more about the social dimensions of health. And I hope that you guys had a chance to really understand what that looks like and what that feels like. I hope that you can take this experience and really um, dissect it and really think about how this affects your life and the people around you, people who you love and care about, because we can all make a difference. This what we shared this evening, we can all make a difference. We can all come together. We can all build partnerships and coalitions and really do what needs to be done so that everyone can live a healthy and happy life. It's not about how much you have or how little you have. It's not about who you're affiliated with or who you're not affiliated with. This is about what we all want. This is about what we are all working for. This is about what we all desire. So I hope that you guys had a chance to really, really take heed to a lot of what we shared. So next week on the Beauty in Us Radio, right here on Awesome God Radio, we are going to have Baltimore City Councilman Mark Conway of the 4th District here with us this evening to speak about his work in the Northeast Baltimore communities. Again, I had a chance to serve the Northeast Baltimore communities under the House Call program for MedStar Health. So I want to talk a little bit about the work that he's doing for his community on April 25th, Tuesday, April 25th, 2023 from 6 to 7 p.m. So make an appointment for our interview next week with Baltimore City Councilman Mark Conway to speak about his work in the Northeast Baltimore community and communities in the Northeast Baltimore district. So I love you guys and I appreciate you guys, and I will see you all next week. I hope you guys are enjoying the spring weather, by the way. We're already in the middle of April. We're almost through April, and it's almost the middle of the year. The spring is here. People jackets are coming off. The warm weather is here, so I hope you guys have been enjoying that. So I will see you all next week. And again, make an appointment to meet me back here. This is Awesome God Radio's the Beauty in Us Radio. I'm your host, Nelson E. Brown. Make sure you follow us on Twitter, Facebook, Instagram at Awesome God Radio. And make sure that you subscribe to our YouTube page at Awesome God Radio. Make sure that you follow me on Twitter and Instagram at Nelson E. Brown and Nelson Brown, and LinkedIn on LinkedIn and on Facebook as Nelson Brown. Thanks again, and I look forward to next week's show. So I love you guys, and I'll see you next